Um, okay, I'm doing the skill of inserting a catheter into a female before I enter the room. I would check the chart to make sure it has an order for the doctor. I knock on the door. Hi, my name is Claire. I'm going to be your nurse today. We're going to be inserting a catheter. Can you just tell me your full name and date of birth? Perfect. Do you have any allergies to iodine or latex? Okay, she has an allergy to iodine. So what we're going to do first is I'm going to give you a bed bath. We're just going to clean your perineal area, make sure it's all clean before we start the procedure. Okay, I'm going to uncover you now. I'm going to have my helper help the legs. Okay, we're just going to bend them. Now I'm going to put an absorbent pad under you, so I'm just going to have you lift your butt as much as you can. Perfect. Alright, and you're good. Okay, so I have my bin filled with warm water. Okay, one side, flip it. The other side. And then right down the middle. Okay, I'm just going to pat you dry. Okay, at this point you're going to remain uncovered until we finish putting in the catheter. And now I'm going to begin setting up my equipment. I'm going to use this as the garbage bag. Okay. All right. All right, I'm just going to put this under you as much as I can. Okay, I'm going to use this to extend my sterile field. Okay, since she's allergic to iodine, I'm going to throw that away. I'm going to open the hydrogen peroxide, pour it over, throw that away, and then I'm going to take this, insert it into the port, open the lube, pour the lube in, throw that away. Now, okay, that's garbage. Put that into the lube. Okay, now we're going to start the procedure. So I'm going to need you to take a deep breath. This may be, I'm kidding, I'm going to clean it first. That was a close one. We're going to fluff it. I'm going to hold her open, and now this hand is clean, so I'll not remove it for the rest of the procedure. And then right down the middle. And these are also garbage. Okay, now I'm just gonna have you take a deep breath. We're gonna insert the catheters. Take a deep breath for me. All right, perfect. All right, we got some flow back, so now I'm gonna push this in. Okay, tuck it until I feel resistance. And at this point, it is a clean procedure, but 1 second. Okay, give that up. Okay, I'm just going to attach it to the leg with the leg band. Make sure the green port is outside of the loop. Just like that. Okay, now I'm gonna hang this below the level of the bladder on a non-movable part of the bed. I would clean up my supplies, dispose of them for the facility. Okay, now I'm just gonna go right into removing it. So I'll start by putting on clean PPE. Okay, Mrs. Jones, now we're gonna take out the catheter. Okay, I'm gonna start by actually emptying the bag. Okay, so I get the bag emptied, and I'm just gonna put it where the absorbent pad would be so I can throw it all the way at once. Now I'm gonna remove the band from the leg. Okay. Okay. Now what I would do is I was just gonna make sure I'm going to deflate the balloon. I'm going to insert it. And just let it come up by gravity. How you doing? We're almost done. Yep. Okay, now the 10 milliliters that I put in is back into the syringe. I'm going to remove it. I'm going to instruct her to take a deep breath, and then I'm going to pull it out. Have it bundled, put it down. Okay, and I would just throw it all away. I would offer her another bed bath to clean the area again. And I'm going to remove this. Okay, I'm going to put her back in a comfortable position, get her covered. And then I lower the bed and put her into a comfortable position.